I'm Carole Yeung, and I was infection preventionist. I was trained in England from Cambridge, and I was doing my part of my training, and part of my training was in a psychiatric area, and that is where I met Tony, and he was doing postgraduate work. So we met and we got engaged, and then he wanted to come to Little Rock, Arkansas. So he got a position, and then he told them about me, that we're engaged. So I went up for an interview, and they hired me also. So we got married to come here in 1976 in December, and then we came over as a couple in June of 1977. And both of us were RNs on the night shift when we first started on medical surgical units. So when we first came, we were known as the newlyweds. Now, a few years later, we're known as the oldie-weds. Made an agreement that, okay, I did it for 2 years. I promised him 2 years, so we never went back. So now it's 43 years we've been here. The original units, the medical surgical units, are very similar to what they are today, except they have been upgraded and they're all private rooms. And when we first came here, most of them were semi-private rooms, not many private rooms, but now everything is all private. And the technology, they have computers. When we was in training in England, we didn't have computers. So, and then all the things that the nurses were allowed to do was a little different to what we were allowed to do in England. So we had a little bit of retraining to do, but gosh, everybody was so good and so gracious to us that we got the training that we needed to be able to fulfill our roles as new RNs here in Arkansas, Little Rock. Culturally, it was a big change. You know, you wouldn't have thought so, you know, coming still two Western countries or modern countries, but it was a big change. And of course, the way they did things in nursing, in nursing here, everything had to have an order. As a nurse, you couldn't do anything without an order, whether to get the patient out, what they ate, how much they could drink, everything had to have a physician's order. In England, we didn't need as many orders to do that. There was sort of standard of care that you understood and you could do. So that was a little different. One of the challenges, making sure you didn't do something you weren't supposed to. And the machines or the equipment was totally different that they had here that we were not familiar with. So I had to learn all the equipment. And I guess one of my memorable moments, our son was born here at Baptist Medical Center on the second floor. So that was very memorable for us. And I remember, you know, how everybody worked very well together on the unit, because I worked on the 7th floor, and I think you were a shift supervisor at that time when he was born. He was born at 15 to 5 in the afternoon, very nice, you know, office hours time. And, you know, once we got all settled and stuff, I remember one of the nurses announced over the intercom that Tony and Carole had a healthy baby boy, you know. So that was very memorable, and they really took good care of us.